What's up? Latae here, and in this video we will be covering the muscles of the hip joint, which, as you know, are a part of the muscles of the lower limb. So the muscles of the lower limb are divided into four parts according to their anatomical location. The first group are the muscles of the hip joint, then we have the muscles of the thigh, then we have the muscles of the leg, and then the muscles of the foot. So again, the muscles of the hip joint are what we're going to focus on today, and they're divided into two main groups. We have the anterior group, which consists of 3 muscles, and the posterior group, consisting of 10 muscles in total, divided as a deep and superficial layers. So let's go ahead and work our way through all the muscles here, starting with the anterior group, and we will use this pelvis as a standpoint of which we will add the muscles on. The first muscle is the Iliacus muscle, which look like this. The Iliacus muscle originates from the Iliac Fossa, as you see here, and then it joins with another anterior group muscle, which is the Psoas Major, which look like this. Psoas Major is going to originate from the vertebral bodies of the T12 to L5, and then distally, the Iliacus and Psoas Major will join each other and form the Iliopsoas Muscle, which is then going to attach at the lesser Trocheanter of the Femur. The Iliopsoas Muscle is responsible for flexion and adduction of the femur, as well as external rotation of the femur, and since the Psoas Major originate from the vertebral bodies, is also going to assist in flexion of the trunk. So that's the Iliopsoas muscle. The third muscle is the Psoas Minor, which is this tiny muscle you see here. Psoas Minor will originate from the vertebral bodies of the T12 to L1, and then insert at the Iliopubic Eminence, and its function is actually assisting the flexion of the trunk. So that was the 3 muscles of the anterior group of the hip joint, the Psoas Minor, and the 2 muscles of the Iliopsoas muscle. Alright, now let's do the posterior group. The posterior group is divided into deep muscles, which consists of 6 muscles, and the superficial muscles, consisting of 4 muscles. The deep muscles are also called the pelvico-trocheanteric muscles, and the reason why is because all of them are going to insert at around the greater trocheanter of the femur, and their function is mainly to maintain the stability of the hip joint and maintain our posture. So the first muscle is the Piriformis muscle, which is this one, viewed from the posterior side. It originates from the lateral part of the anterior surface of the sacrum, from S2 to S4 segments of the sacrum, and then it inserts at the greater trocheanter of the femur. The Piriformis is responsible for the external rotation of the thigh, as well as abduction of the thigh. Next we have the Obturator Internus muscle, which is located on the inner surface of the obturator opening. It originates from the inner surface of the obturator membrane and inserts at the greater trocheanter of the femur. And when it contracts, it externally rotates the thigh and abducts the thigh as well. Then we have 2 muscles here on the backside called Gemellus superior, which originates from the ischial spine or spina ischiadicum, and Gemellus inferior, which originates from the ischial tuberosity. Both of them are going to insert at the greater trocheanter of the femur as well. And when they contract, they will externally rotate the thigh, as you see here. Another muscle is the Quadratus Femoris, which is this one. I know a lot of people who mix it with the Quadriceps femoris, the large muscle of the thigh. This is called Quadratus Femoris due to its quadrangular shape. It originates from the ischial tuberosity and inserts at the intertrochanteric crest, as you see here. And then when it contracts, it will externally rotate the thigh and adduct the thigh, pulling it medially. So that's this one. The 6th muscle is the Obturator Internus muscle, and I put this one last because some sources consider the Obturator Internus muscle as a part of the muscles of the thigh, and some sources count it as muscles of the hip joint. So keep that in mind. I find it more logical to put it with the deep muscles of the hip joint, but it can vary depending on the source you're studying from. The Obturator Internus originates from the external surface of the obturator membrane, and then it's going to insert at the trochanteric fossa, and when it contracts, it's going to externally rotate the thigh and give an accessory flexion of the thigh as well. So that was all the deep muscles of the posterior group of the hip joints. Now let's do the superficial muscles. These include the 3 gluteal muscles and the tensor fasciae lata. One thing they all have in common is that they facilitate standing up from a sitting position, They help climbing upstairs or uphills, and they also prevent the hip from deviating over to one side. So they're very strong and very important for our posture and stability. Alright, so first we have the Gluteus Minimus, which is this one. It originates from the gluteal surface of the ilium between the anterior and the inferior gluteal lines, and then it inserts at the greater trochanter of the femur. The main function of this muscle is abduction of the femur. However, anterior fibers can internally rotate the thigh, and the posterior fibers can externally rotate the thigh. Then we have the Gluteus Medius, which is here. It originates from the surface of the ilium between the anterior and the posterior gluteal lines, and insert at the greater trochanter of the femur, as you see here. The function is exactly the same as the Gluteus Minimus, which is abduction of the femur and internally or externally rotating the thigh, depending on which fibers are contracting. Now, let's talk about the big guy, the actual muscle forming the majority of our butts. It's the Gluteus Maximus. This muscle is going to originate from several areas. It originates from the gluteal surface of the ilium behind the posterior gluteal line, and the posterior surface of the sacrum and the coccygeal bone. It also originates from the sacrotuberal ligament, which is this one highlighted in green, and the thoracolumbar fascia, which is the fascia covering the lumbar region, as you see here. So fibers of this muscle originate from these areas, and then they insert at the gluteal tuberosity of the femur, as well as the iliotibial tract. The iliotibial tract is a fibrous tract that is formed by the fascia covering the thigh, and we'll talk a little bit more about it when we cover the fascia of the lower extremity. Now, the function of the Gluteus Maximus is abduction and extension of the femur, as well as externally rotating the femur. So that's the gluteal muscles. The last muscle that I want to talk about is the Tensor fascia lata, which is here, located on either side of the hip. It originates from the anterior surface of this iliac spine, and then it continues into the iliotibial tract to then insert at the tubercle of the iliotibial tract, which is down here. And the function of the tensor fascia lata is, well, it tenses the iliotibial tract. And once this tract tenses, it extends the leg forward to lock the knee joints. So this muscle stabilizes the knee joint through the iliotibial tract, but it also assists with flexion of the femur. So that was the superficial muscles of the thigh, and that was all the muscles of the hip joints. Next, let's go ahead and cover the muscles of the thigh.